Hello, I'm Petra Lewis. I'm going to give you a quick introduction to the elective that you're going to be starting in the next week or so. Please feel free to listen to this on as fast a speed as you wish. This is really just to get some of the really boring stuff out of the way so we can start straight in our first session by doing some radiology. So welcome to radiology. I hope you're going to have a very productive 4 weeks with us. It's very intense. We do a lot of stuff, but I think you'll learn a lot and find it's fun. So this is what we're going to be talking about. We're going to introduce you to the personnel who will be running this elective, some of the structure and expectations, the resources, both concrete and online within the department for your use, how to start thinking about your clinical rotations, and then finally a quick to-do list. And I will be showing QR codes for a bunch of the links, so feel free to just stop the video at that point and flash them with your camera so that you've got those already linked before you start. So I am the director of this elective. I'm not in on Fridays, but you can contact me by email. Dr. McNulty is the associate director. She's not available on Thursday and Fridays on site, but again, she's usually available by email. And Matt Henry, who you've probably already had emails from, is our elective coordinator. Here's his phone number here, and he is very responsive to email, and he's really the first stop for you if you have any problems. You should have already been sent a link to sign up for the RAD502 site on Canvas. That's going to have a lot of this information I'm talking about here, information about the staff, course documents, as well as the lecture slides. And here's that link if you just want to flash it. The other really important site for you to have a link handy for is the Knack elective website. It's written here. I'll show you a QR code in a minute. And there's a lot of stuff that's on here. So we run a lot of the rotations via Knack. It has linked resources. This is where you're going to submit your answers for sessions such as diagnosis, please, and the cases of a day. You can find links to all the elective manuals here. So here's that QR code if you want to freeze for a moment. Here's the home page for the Knack student site. Just to show you a couple of important things. Here are the elective rotation schedules. Here you can see the lectures that are given specifically to the students. The noon conferences, which are also given to the residents, are actually at 12:15, are going to be here. And if you want to find what the clinical rotations are for residents and faculty, that is going to be here. Couple of the important things you can see are on the top line of buttons here. The wired, which I'll show you in a moment, which are short learning modules, is up here, and quizzes that you'll go in and enter your answers for are all here. As I mentioned, QGender is the scheduling software that's used in the institution for clinical rotations. The link is here. It's also linked, as you saw, off the elective website Knack page. And if you go there, you can find out who's on call in the evenings. You can find out where specific residents and faculty are on any day. And here again is that QGender link, and it is open access. We put a lot of work into making what we think is very useful elective manual, so please do look at this, review the modality-specific goals and objectives before you do each of the clinical rotations, and it'll really help you focus areas of study, and there are a bunch of learning links in those. You should have been sent a manual. By chance it's got lost in your email, then you can find it again on the Knack homepage. This is just going to give you an example of some of the outline of the schedules that you'll be doing on the 502 elective. So here in week 1, I start with an introductory session and a PACS workshop that takes up most of the Monday morning. There's a session on chest X-ray anatomy and chest search strategies, and that usually happens on the Tuesday or Wednesday. And then there's a variety of other lectures and Aquifer workshops, clinical rotations, the residents' noon conferences, and we usually do an ultrasound hands-on workshop at 5 p.m. one evening that week. For the remainder of the rotation, you're going to continue to have clinical rotations. They take up about 50% of the time. There are the remaining lectures and Aquifer workshops. Dr. Austin will do cool cases once a week, which I'll describe to you in a moment. There is an imaging lingo workshop, and there are 4 imaging algorithm workshops. Usually in week 4, we have the Esac conference, so I'll explain Esac. There is an Imaging Jeopardy game, which is a lot of fun. It's run by the residents. And then on the last day, you will have an exam. At 12:15 every day, there is a didactic conference for the residents that you need to attend. It's done in the large conference room. The only times you don't need to attend is if there's a staff meeting, a QA meeting, or a resident meeting. And these are also, the schedule is also linked from Knack. We have a number of conferences between us and the clinical services, which are listed here. I'll let you read through those. I particularly would like you to go to the GI and GU conferences. For those of you interested in neuro ENT, this is an excellent conference. And if you're on the press rotation or interested in OBGYN, this is also good. And if you're going into rheumatology or orthopedics, try and attend the rheumatology one. But everybody should attend the GU and the GI ones. The prior conferences, which are multi-specialty but really educational conferences, are very helpful for learners in radiology, but we also have tumor boards. And if you're interested in specific areas and you'd like to attend a tumor board, they're done virtually at the moment, but they will be back in person soon, hopefully. Let us know and we can let you know when they're on. For those who are interested in going into radiology, or at least exploring it as a career, we do offer an optional private practice day during your elective time. There are a variety of different sites that we staff from DHMC with some of our regional radiologists, and just let us know and we can schedule that. On the first morning after the intro session, I'm going to introduce you to the PACS system. That's how we read and process many of our images in radiology. You will get logged in using your usual DH Windows login here, and we'll set the system up. There are also directions in your guide. The student teaching files are all on this PACS work system, so it's important that you know how to get in there and how to access them. And this is going to enable you to be able to pre-read studies when you're on the clinical rotations. There will be 2 or 3 sessions of cool cases. They're usually moderated by Dr. Austin, but sometimes others do it. And this is when you will present cases using the PACS work system in the large radiology conference room to your colleagues. So I would recommend that when you're on your clinical rotations, you just don't note down any particularly interesting case that you come across, or you can put them into one of the public elective folders, and then they'll be available for others in the past, and you'll just call them up by the medical record number and talk about them to your colleagues. And Dr. Austin is really there to facilitate this and just help you with any background information. And you can do this any way you wish. You can get your colleagues to take the cases. You can do it as a show and tell. Things that these don't have to be wildly rare conditions. In fact, common diseases or good teaching points that if you felt you learned something on, then probably your colleagues will learn something from. And as I said, just bring along the medical record number and you can show it. Take about 5 minutes per case. It's very informal. And if the facilitating staff are late or absent, just start without them. You don't need us there. There are resident-run case of the day sessions. Monday through Thursday, you can see that there is a case to be completed every day. The link is on Knack. Complete all of them before Thursday night. You can do them all in one go. They're not very long. And then on Friday, one of the residents will discuss the cases and your responses to them during a session. There are 4 imaging algorithm workshops in musculoskeletal radiology, neuroimaging, GU interventional, and chest GI, with the different facilitators are listed here. And the objective of these workshops is for you to be able to develop appropriate and cost-effective imaging algorithms for common diagnostic situations and what effect changing the patient variables may be as to the sort of exam that you need to do, helping define further management and so on. The cases are all in your packet. You don't have to prep anything beforehand apart from just review the case history and start to think about the type of imaging algorithms that you would want to do. And this is a group discussion with a facilitator. Here's some of the things that you want to consider when you're thinking about what type of imaging you should do in this case. Some of the patient variables, such as their age, their sex, any presence or absence of any obesity or contrast allergy if they're claustrophobic. What would you do if they had a pacemaker? What would you do if they're medically unstable, and so on? Is it a cost-effective study? What's the sensitivity and specificity of these particular studies? And what would you do if you were perhaps at a more regional hospital that doesn't have MRI at 3 in the morning? And then finally, how would the presence or absence of a comparison study help you? An extremely useful resource for this that we would like you to get yourself familiar with while you're on the rotation are the ACR appropriateness criteria. You can get at it by Googling ACR appropriateness any point. You can flash this QR code here if you want to take a look at them. And what are these? These are evidence-based guidelines that were put together by a combination of both radiologists and clinicians in that appropriate specialty. You will come to this page, scroll down on it. You're going to then see here a couple of different ways of going in and looking at them. I usually just go in under this because then I don't have to log in. The registration login is free. And then you're going to see something like this. So they're split into diagnostic and interventional radiology. You can select a panel here. Here I've selected musculoskeletal. And you can see for the musculoskeletal topics, they're each, and this is only a part listing of it, there are specific clinical scenarios that you look at. You then click on one of those and you bring up the narrative and rating tables here. And here is what I would see if I looked under the clinical condition chronic neck pain from one of the neuro appropriateness criteria, and it's going to give you a variety of different things. It's going to give you a bunch of different variants of chronic neck pain. If you scroll down, you'll see there's variants 2 through 5 for this particular clinical scenario. It's going to give you the different radiological procedures in decreasing order of appropriateness. And then it will rate them on a 1 through 9 scale, with 7, 8, 9 is usually appropriate. 4, 5, and 6 may be appropriate, and 1, 2, and 3, you really don't want to do that in this scenario. And then it does give you some idea of the relative radiation level of these procedures. So here's another variant in this case with normal radiographs and neurological signs or symptoms, and all of a sudden MRI now moves up to the top here. So these are really useful resources when you go out into clinical practice for doing appropriate imaging. And then you'll see linked to each one there is all the data and the studies which were used to support that table. Dr. Austin also holds an imaging lingo workshop. And the purpose of this is for you to really sort of decode some of our radiological lingo. So define the correct use of terms, identify inappropriate terms that you shouldn't be using, like white out of the lungs, or confusing terminology, because we understand we do use a lot of lingo. You don't have to do anything specific for this, but if there's been some terms that we've used, you've always wondered what they meant, bring them along. And Dr. Austin will also discuss these and a bunch of others and demonstrate some examples. And here's just some examples of the sort of terminology I'm talking about here. As you see, you're going to be seeing Dr. Austin a lot. She also does the Esac conference. Now, Esac is case backwards, and the objective of this session, and this is pretty fun, is to get you guys to use radiology terminology correctly to describe radiology findings. And this has a somewhat unusual format. So we have some cases that show classical findings that if you describe them correctly, the person should be able to get the diagnosis without ever looking at the image. So we have one student facing the projector and the other students face the back of the room, and they can draw or describe the abnormality as it's being described by the student who can see the image. And there's a team effort to make the diagnosis. And obviously the student facing the image mustn't give the diagnosis. And this is an example of an Esac session going on. I guess that this person in the middle here is doing the thinking about rather than the drawing. Or she's having a nap. About half of your time in the 4-week elective will be spent on clinical rotations in the diagnostic areas listed here. So you'll be assigned to one of these different diagnostic areas every day. There is also some self-study time, and there are 4 potential elective slots, and you can decide where you want to spend that time. So you could spend it in self-study, you could spend it as an optional private practice day or 2, or you can do additional time in any of these clinical areas depending on your future career interests. These clinical rotations will be scheduled the first day, so please come with some proposed plans for the elective time. A couple of words when you come on the clinical rotations. Things are a little bit more challenging with COVID, but we're still doing these. Now everybody is vaccinated. So please, when you turn up, introduce yourself when you arrive. Ask either the residents or the faculty who are in that room who you should sit with. There may be a free workstation available for you to pre-read images, or there may not. At the moment, a lot of the workstations are in faculty offices, so it's a little more challenging. Please make sure that you wear a name badge. Please excuse yourself for lectures or workshops. Nobody apart from the core student teaching staff are aware of when these lectures are happening, so just let them know that you're late because you had an 8 a.m. lecture, or you need to go at 11 because you have an 11 a.m. lecture, so that they can plan things accordingly. And just realize there are times when the clinical service gets crazy and we really just have to plow on, and at that point you can either use your time by just listening and learning, or you can do some of the teaching resources that we have available. These clinical sessions are obviously a lot more fun if you're able to be an active participant. So if you're able to pre-read studies, sometimes you can do it on your own laptop if you bring one, or spare workstation, help with the workflow, look up clinical data about patients, phone clinicians, research questions, and you are more than welcome to come along into procedures with us and help if that's possible. And then if you have downtime, the most effective use is probably to do Aquifer cases or do some of the short wired modules if things are quiet. You can also, on a PACS workstation or on your laptop, look at some of the student teaching cases that are available in the public folders that we will show you in that first PACS workshop. There's a tremendous number of really useful cases that are high yield. Here are the times clinical rotations start. IR, fluoro, and breast start a little earlier. The others start at 8 o'clock. When you're sitting at the workstation with a resident or faculty, as well as thinking about what the images are showing and interpreting them, but think about these other questions as well. So why was this particular exam ordered? Was it the best exam for this disease, for this patient? Is there something that was more cost effective? Sometimes we don't know why they ordered that particular exam, but these are good topics to think about. You also want to think about, are there any risks to these exams? How was it performed? Will the results affect the management of the patient, or is it really an unnecessary exam? You will be given a list of exams that we recommend you go and watch. Feel free at any time when you're on one of the rotations to just go and spend some time with the technologist. So go in and watch a couple of patients have a mammogram. Go in and watch a couple of patients have a CT or an MRI, a nuclear medicine scan, a fluoroscopy exam, and so on. We have some slight differences in the how you will work in interventional radiology. We try to block up time there. So late the afternoon before, go over to interventional radiology. The cases will be up on the board, and you can select 1 or 2 cases that you want to follow through and be in with. Just check with the staff or the residents what would be appropriate cases. You can then read up about the patient in EPIC. You can click on the interventional radiology manual that is linked to be familiar with the procedure. And then on the day of rotation at 7 o'clock, go to interventional radiology and introduce yourself to staff. They'll help you find lead. If you haven't already got scrubs, then they can direct you towards that, but Matt can also show you where the scrubs are available. There's a meeting at 7:15 in the morning, and then really try to be involved with those cases, scrub for them, read around these cases, any downtime, and then lectures are optional. If you're in interventional radiology, we certainly don't want to pull you out of cases. Attend them if you can, but if you can't, we understand. As I said, one evening there will be a resident-led ultrasound workshop where you'll learn how to use the scanners, begin to understand some basic ultrasound anatomy and the different ultrasound characteristics of tissues, and you're going to scan each other. If women are willing, your colleague can also scan your pelvis transabdominally, obviously, not transvaginally. If you're willing to have that, then fill your bladder. If you guys come hungry and with full bladders, it's going to be more interesting scanning than if you've just eaten and emptied your gallbladder. This is entirely optional. Anyone who's not comfortable with being scanned does not need to. Ultrasound, we really try and get you guys to go in with a technologist rather than spend all your time in the reading room. So, be proactive about asking to go in cases, but polite. The techs are very helpful. They're very used to this. Go in, watch the exams they do, and then after they leave and they go out to fill in some paperwork or some computer work and show us the study, you're going to have 5 to 10 minutes that you can scan the patient if they're willing to be scanned. Obviously, you can't do TV transvaginal scanning, but if they had a right upper quadrant ultrasound something, just ask them. It's okay if you scan. It's important you don't delay patient throughput, but there are a few minutes for back scanning at the end of cases. There are 2 diagnosis please sessions which are held. The links are in Knack. You need to go in and complete the cases. They're all images with questions attached to them before each of these diagnosis please sessions. They're common conditions, classic findings. These are then reviewed as a group with the facilitators. They are not formally scored, but we do expect you to complete and participate in the sessions. Most of you should be familiar with the Aquifer cases. You've probably had them in various other rotations, such as pediatrics and OBGYN. You will be given some self-study sessions, and one of the things that you'll do in this is go through the Aquifer radiology cases. There are 18 cases that cover the curriculum as well as the exam content note, and you're expected to do all of these cases. You get in using your Geisel email, and you can just ask it to send you instructions to reset your password, and there is the access address. And here is that login for Aquifer. And we have a number of Aquifer workshops that are based off these radiology cases. So cases 1 to 4, 9 to 12 have workshops based on them, and they apply concepts that you've learned during the cases. These are very interactive workshops. They're fun, but it's really important you do that case before the workshop. If you have any areas that are unclear to you, then please just scribble them down so we can discuss them during the workshop. And these will all be identified clearly on your lecture curriculum, and pre-work will be identified there as well. As an adjunct to the imaging algorithm workshops is ACR Teaches, and the ACR Teaches are online case series to teach you image appropriateness criteria. They're all case-based. There are 3 self-teaching modules that you will be sent the logins by Matt. There's a pre-test on week 1. In weeks 2 and 3, you can do the teaching module at any point, and then a post-test on week 4. They are not part of the final exam grade, but we do monitor that you've done them. And here's the QR code for the login for teachers. We supplement your ultrasound training, which most students are extremely interested with the widespread use of point-of-care ultrasound these days, with Sonosim Ultrasound Modules. There is a Fundamentals module that I highly recommend you do before your first ultrasound session, and preferably before the ultrasound workshop is going to help you. And then there are different modules depending on the different organ parts that I've listed here. Here's the QR code for the login to get into Sonosim. The ones that we require you to do are fundamentals and the renal and biliary clinical sessions. The others are optional but recommended, particularly if there is a module within your area of future career interest. A lot of your prior colleagues and myself have developed wired widgets. These are widgets in radiology education. These vary. Some of them are like 1 minute to 2 minutes. Some of them are longer didactic lectures that we've linked within the widgets system. And these can be accessed from the elective page. There are also printouts of the ones that relate to specific clinical areas in the reading rooms. These are constantly being added, and there's a variety of different ways that you can access them. I would recommend that you download the Book Widgets app onto your smartphones, and then you can just flash the QR codes. You can also use your laptop and just click the links. Here's that login to the Wired page. And this is what you'll see when you go to that site. And as you can see, you can sub-select down onto the different specialties here. You can also sort by learner level. So whether you want to have a something that's a higher level resident type module or student, or ones that are suitable for both. And then just click onto the link and it's going to take you straight into each of those modules. I say they're all interactive. And yes, there's more to come. Each day you're going to be sent by email a case from Quiz Time. These are sort of radiology essentials. They're not scored. We don't track participation, but we do highly encourage participation. I think you'll find them good reinforcement for the concepts that we're teaching throughout this elective. On a similar note, some of your colleagues and myself, and also students from other institutions, have developed the RAD cases. And this is really something you should think about signing up for, which will continue over the next year or two. This is a curriculum-based, bi-weekly interactive cases. They are deployed through a variety of different social medias listed here. And these are really using the concept of spaced interval testing. So you're going to learn a lot of stuff in the next month, and this will help reinforce it as time goes. They take, literally 2 minutes to do. So consider going to the RAD site and signing up for them. And here's that site, which is just dartrad.org. If you're considering going into any of the intensive care specialties, surgical specialties, anesthesia, and so on, you might want to consider doing either now or sometime in the future this lines and tubes module that was developed by one of our prior residents, actually when he was a medical student, Ju Cho, and you can download this from Canvas and you can download it from MedEd Portal. All right, and what about the exam? So this is going to be on the last Friday. You will log into the Internet STARS system. This is a national exam. It has 113 multiple choice questions. They're both image and non-image based. Matt will send you your logins from that, and it's also linked from Knack quizzes. You can get straight in there. And here's that link to STARS. This is given under honor code, so please don't cheat. If you get a really, really high score, I'll kind of know you've cheated. Please submit it before the end of the time expires. You have 2 hours to take this. It shouldn't take you anywhere near 2 hours, hopefully. There is also a 20-question optional practice exam that score does not count towards the final grade, and you can take this at any point prior to the final day. The student resource room is currently being shared with a PACS workstation due to COVID. If it's free, you're welcome to use it. There is a computer there that you can log into. Key code is 135, and there are links to the teaching file on the desktop. We will also be providing lockers for you. So your primary learning resources for this elective outside of the teaching and clinical services and the lectures are the Aquifer cases and the hyperlinks that we provide in the handbook. We do provide you with a copy of the Lewis and McNulty Oxford Handbook of Radiology, which of course is excellent, if I say so myself. I think you'll get a lot out of reading this. The 2 chapters you must definitely read before the rotations in these areas are the ultrasound chapters and the women's imaging chapters before breast. If you do this, it's going to really help you. So I try and get a fairly 360-degree view of the students. So I ask for feedback from residents and staff of how you're doing in the reading areas, how you're doing things like the image management workshops, the other interactive sessions, as well as the elective quiz. And as I'm sure you're familiar to now, it is a competency-based evaluation, although it's specific to radiology, so it's not the generic one that you may receive in some of the clinical areas. We do ask fairly comprehensive evaluations from you of this rotation and of our faculty and residents. I really ask for you to complete these before I submit a grade. They are anonymous. You will be asked to evaluate the elective and the resources, as well as individual attendings and residents. I use this extensively to redesign the elective each year. But just to remember, please put, I'm not saying you have to do positive comments, but they should be appropriate and professional and constructive. They do become part of the permanent record for the faculty and residents. If you have any problems, scheduling problems, first stop is Matt. If you're having interpersonal issues with faculty or residents, please come and talk to me as soon as possible. I know there's always two sides to this, and I want to hear yours. Any sicknesses or absences, just email both Matt and myself. And then finally, we're really here to help you and help your patients. So please use us as consultants. We may suggest an alternative investigation. Don't be afraid either now or in your future careers to ask us for advice. We're not going to think you're stupid. We acknowledge your expertise is in your clinical area, but do know something about the patient before you call us. So here's just finishing with the task list of what you're going to do outside of your clinical rotations and your lectures. So imaging algorithms, you need to review them for the workshops. Sonosim modules, complete the required ones and any others you want to do by the end of the elective. Oh, there should be diagnosis, please, 1 and 2. Sorry about that. Complete them in Knack prior to the day of the session. Case of the day, go into those 4 links by Thursday night. Imaging lingo, just bring any terms that confuse you. No other preparation needed for that. Complete the Aquifer cases and the teachers modules by the end of the elective, and then submit your evaluations on SurveyMonkey. And that's it. I look forward to seeing you the first day and not having to repeat all of this. Bye.